All right, welcome back. So last week she came in as Tooth Fairy Lady, but as she's back with her normal self and with a guest to give us some more valuable information. Dr. Lady from Abilene Dental is here to tell us more ways of maintaining a healthy smile, especially as you get older. And we have David Hare from Wisteria Place to assist us. How are you guys doing today?
Great.
Doing wonderful.
I love how you guys are smiling. I love it. It's a good time for this topic. But the topic is, as we age, we also have to have, there's certain things that we need to be cautious about and to maintain for a healthy oral smile. And we have Mr. here to help to ask questions, is it?
Yes, yes.
So different segment today, so I'm going to let you guys take that away actually for questions for Dr. Lee to answer.
Absolutely. You know, we had a few conversations over the last few months, and she was a guest on a local radio show that I host. And one of the things that we both agreed is that there's a saying about the eyes being the windows to the soul, but the mouth can be the window to someone's overall health.
That is a tweet right there.
Exactly.
Sure.
And at Wisteria Place Retirement Living, we care for 250 plus ladies and gentlemen on the everyday, all of them with varying health conditions.
Right.
And oral is every bit as important as the other things we talk about. You know, the teeth and gums. Dentists can evaluate a mouth and see things like eating disorders and diabetes and arthritis and
just from looking at the mouth.
Exactly. Wow. It's all coming from what they see orally, and in fact they're tying in quite often to their primary care physicians and so on. And so just to share with you, for example, Dr. Lady, tell us about the correlation between gum disease and heart disease.
Yeah, we're seeing more and more correlations all the time.
Yeah.
But the staph and strep bacteria that affect your overall oral health, that eat away at the gum tissue and the bone that holds the teeth in, is also the very same bacteria that can affect your heart valves. And so it makes you at a higher risk for heart problems, heart attacks, stroke, all of those things. So we're, again, having more and more interaction with the primary physicians and the cardiologists, because a lot of times if we see that your oral health is not under control as far as the periodontal disease,
right,
then that same person will have precursors to heart disease.
Wow.
So it's so interesting.
The connection.
Yeah.
Right.
I know that you also have a second question.
Right. We see this on the everyday. What are some of the other diseases that have that same kind of interrelationship?
Yeah.
There are many.
Yeah, and we're finding more all the time, but lung disease, as we talked about, heart disease, 14% increased risk of pancreatic cancer. Now, I mean, you know, everything that has to do with oral health can also have to do with overall health. Diabetes, to keep diabetes under control, so often it has to do with infection levels and that type of thing. So if you've got this low-grade infection in your mouth and nobody's seen it, it can cause the blood sugar levels to stay out of control. So we're finding more and more things that make it so important to have your overall checkup and your oral checkup together.
Okay. Well, I know we don't have much time, but let's answer this question real quick, because I'm also interested in this last question.
Right. Well, the last question would be, people tend to focus more on other diseases than their oral health. Can you explain why sometimes the focus is different? If there's a correlation between the two, why is the other more important?
Yeah, used to people saw teeth as expendable, you know, and so they were always going to lose their teeth. But also, gum disease usually doesn't hurt. So by the time that it's advanced, you may not even have realized that you have gum disease. So that's why the regular checkups are so important. And you know, a few little signs: bleeding gums, teeth that could be mobile, when you build up a lot of tartar on the teeth, but still, sometimes those don't even show up. So it's so important to get a checkup and check for all those things, because it hides from you.
All right. Well, thank you so much for joining us, for both of you. Very informative, as always. And if you can make your appointment at Abilene Dental, do it today. Just call the number on your screen or head into their offices off Buffalo Gap Road. Also, check them out on Facebook and Twitter. And for more of her advice for a healthy smile, search Abilene Dental on BigCountryHomepage.com. Well,